Hello, friends. Welcome back to the Test Those Breasts podcast. I am your host, Jamie Vaughn. I'm a retired teacher of 20 years and a breast cancer thriver turned staunch, unapologetic, loud supporter and advocate for others, bringing education and awareness through a myriad of medical experts, therapists, caregivers, and other survivors. A breast cancer diagnosis is incredibly overwhelming with the mounds of information out there, especially on Dr. Google. I get it. I'm not a doctor, and I know how important it is to uncover accurate information, which is my ongoing mission through my nonprofit. The podcast includes personal stories and opinions from breast cancer survivors and professional physicians, providing the most up-to-date information at the time of recording. Evidence, research, and practices are always changing, so please check the date of the recording and always refer to your medical professionals for the most up-to-date information. I hope you find this podcast a source of inspiration and support from my guests. Their contact information is in the show notes, so please feel free to reach out to them. We have an enormous breast cancer community ready to support you in so many ways. Now let's listen to the next episode of Test Those Breasts. Well, hello, friends. Welcome back to this episode of Test Those Breasts. I am your host, Jamie Vaughn, and today I am thrilled to have my guest on my show, Sheila Mikhail. Sheila is a serial biotech entrepreneur. She has successfully started and exited 3 biotech companies representing total transaction value in excess of $5 billion. She has raised hundreds of millions of dollars from Wall Street and created hundreds of high-paying jobs. Despite her success, she could not access appropriate breast cancer screening, even at one of the best cancer centers in North Carolina. Since her diagnosis, she has been fighting for expanded insurance coverage for supplemental screening in her state of North Carolina and to change the medical guidelines and local standard of care to include supplemental screening for dense breast tissue. Well, hello, Sheila. Welcome to the show. How are you doing today?
Oh, I'm doing great. And thank you so much, Jamie, for having me participate today.
Well, this is such a huge topic right now. Having just had the Find Out My Breast Density Day with My Density Matters, and we all collaborated with Leslie and Susan and Dixie over there. So it's such a huge topic right now, and I'm so grateful there are people out there like you who are fighting the good fight. And you are also a breast cancer survivor. So you have lived experience and knowledge, and you have this burning desire to help out with this. But I want to first start off by asking you, who was Sheila before breast cancer?
So Sheila was a very confident person. I had just sold my last company in a $4 billion transaction. So I was on top of the world. I had also just been named the 2021 EY Entrepreneur overall U.S. winner. And so life couldn't get any better. I felt great. I was healthy. You know, the world just seemed like it was my oyster. That's why it was very surprising just a few months after getting a clean mammogram in 2022. I was getting out of the shower and I saw a small dimple on my left-hand side. My first thought was cellulite. You know, we're getting older. I had just turned 56, and so a little bit heavier. So I thought, wow, this is aging. Your boobs start sagging a little bit. I didn't think much of it, but I mentioned it just, off chance to my daughter. And my daughter said, Mom, you really got to get that checked out. I was never supposed to get breast cancer. I never thought I was going to get breast cancer. I still remember getting my last screening mammogram in 2022 thinking, well, this is a waste of time, but I'll just check it off and I'm good for another year. I was always told because I'm thin, I don't smoke, I eat right, don't eat red meat, eat a lot of fish, I exercise, that I was like at low risk of getting breast cancer. And I was always told I didn't have it in my family, right? So don't worry about it. But when I went in and asked for additional testing, they did a diagnostic mammogram, both on my left and right-hand side, and it was clear that they had difficulty finding it. They had to do an ultrasound and it came back, they saw something. They thought it was in my lymph node. They thought it was sizable. I waited 10 days to get the biopsy results back. And when they came back, it was a large, they thought it was over 2 centimeters, slow growing tumor. So I sat down with the oncologist and I said, well, how do we know I don't have breast cancer other places, like on my other breast? And I was told first, nobody gets bilateral. And I think this is something that's important for people to understand, that bilateral is actually not uncommon. Then, second of all, I asked for some additional screening. I didn't know what to ask for. I didn't know if it was an X-ray, PET scan, CT scan, et cetera. And I was told I really didn't need it and it wasn't the standard of care. When I pushed again, I was told it would cost me $1,300. And I said, no problem. Here's my visa. I am insistent on this. And then the oncologist, and this is Duke Cancer Center. This wasn't, some rural place in North Carolina, basically told me I was creating a ruckus. Well, and that's why I started a foundation called BC Ruckus.
I love it.
Yeah, I wish it was not necessary. But when the test results came back from a breast MRI, I actually had a larger tumor on the right-hand side that wasn't caught by the screening mammogram or the diagnostic mammogram. And so I think the key is for women, I knew I had heterogeneously dense breast. I had been assured by my doctors, and again, top doctors at Duke and, on faculty at UNC, my GYN was on faculty, absolutely assured that 3D, tomosynthesis is right for my heterogeneously dense breast. And now I think there's a lot more information that's just not true. 3D mammograms are really not much different than regular mammograms. And in this state, women are still having difficulty accessing that supplemental screening. It's just not the standard of care. They get a lot of pushback. They're told over and over again the 3D mammograms are adequate. Mm-hmm. And so that's one thing in this discussion. I really want to push women, to seek out that supplemental screening.
Definitely. So when you got your breast cancer and you were diagnosed in 2022, so was I.
Correct. Oh, I'm sorry we share that. That's not a club we want to be a part of.
What a year, right? What
good people in a horrible club.
What type of breast cancer did you have, and what stage, what treatments did you have?
So I had a total of 4 tumors.
Oh, wow.
And I want to highlight that 10 centimeters of cancer, all missed by 3D mammograms. I got a stage 2 diagnosis for each breast. I did a mammoprint, and this is really important. Everybody assumes that you would naturally get chemotherapy, but actually there's a test that can be done to tell you whether or not, 1, chemotherapy is going to be effective, and 2, if it's really necessary. So my doctor at UNC, I was very happy with my cancer care at UNC. She did this mammoprint test, and it said that I was less likely that I was going to have a distant recurrence. And in addition, for lobular, chemo doesn't really work as effectively. So we decided not to have chemotherapy, but I had 66 total radiation treatments. So I was glowing. And then afterwards, I'm on anastrozole for 7 to 10 years.
So you had lobular breast cancer.
Yeah.
So when I went to the breast cancer symposium, I roomed with my friend Claudia, and she had lobular, and I had never heard of lobular. So I actually got to hang out with a group of women who had lobular breast cancer. And that is the kind too that sort of sneakily hides.
But not on an MRI.
Okay.
It does on mammograms. It's not is easily detectable, just like triple negative is not as easily seen on mammograms. But on breast MRI, it was like 2 shiny headlights in each of my breasts. It was very obvious that I had cancer.
But obviously not everyone knows that they need to get an MRI. So we need to educate people that a mammogram is not enough.
No, it's not.
How would someone know that? How would someone know that they have to get something? I mean, every single woman should get supplemental, I feel
every single woman who has dense tissue, which is 50% of us, because mammograms, including tomosynthesis, 3D mammograms, miss up to 50% in tumors in women with dense tissue. So think about it. Would you get on an airplane if you knew TSA was missing 50% of the bombs?
No.
But yet women are being told, don't worry about it. It's crazy. It's
So
absolutely crazy.
let's talk about what you're doing in your survivorship, because what you do, Sheila, is so extraordinarily important. And I'm learning more and more every day from people like you and Leslie. And I mean, I had dense breast tissue. I knew in my 40s that I was supposed to get supplemental screening. So I just thought it was just a normal thing that everyone with dense breast tissue got. And this is not the case.
It's not the
So,
case.
you talk about insurance coverage and actual access to screening, and they aren't the same. So, can
No.
you help listeners understand what the gap looks like and why that matters?
Yeah. So the gap is twofold, I think. One is education. I mean, I clearly could afford supplemental screening. I could have afforded the MRI machine, right? But, I relied on my doctors. One was a faculty member at UNC that I had seen for 20 years, and the other was, a very well respected doctor at Duke. I was going to Duke Cancer Center for my screening. And I was told over and over again, and I asked repeatedly when I, found I had dense tissue, and I was told, oh, 50% of women have dense tissue. You just have a little bit of density, just heterogeneous. It's not really dense. That's all nonsense, and by the way.
Right.
And they just can't see is the bottom line. It doesn't matter if you have a little dense or a lot dense, they just can't see. And so I think that's one thing. We need more physician education, right? That we really do. The second thing is insurance coverage. I went back to Duke and spoke with, Rick Shannon, who is the senior vice president of quality, and Karen Johnson, who's the head of breast imaging there. And I'm like, what the heck? I trusted you. You betrayed the trust. How do we fix this for other women? And that's where I first heard that insurance coverage was a big factor in why I wasn't offered supplemental screening. Because without the insurance coverage, it wasn't the standard of care. Even at places that are supposed to be renowned cancer centers like Duke Cancer Center, it wasn't part of the practice to give the next step in screening. And when I spoke to them, they know that they're missing tumors. They know it, but they're not going to tell you as a woman to get the additional testing. And in fact, I fought with them to put up brochures and banners right in the mammography waiting room so women at least could advocate for themselves. I ended up paying out of my own pocket to get these banners and these little, handouts, brochures on dense tissue. I worked with My Density Matters. Leslie's an amazing woman. I worked with her to get the information disseminated and paid for it out of my own pocket, if you can imagine that. It's silly to me. I can't understand how, we trust our doctors. We think that they're doing the right thing for us, but they're motivated by insurance interests. And without insurance coverage, many of us just don't get access. And even today, right, with those brochures in hand,
Right.
I have people report to me that they've gone to these imaging centers and they're basically told the 3D mammograms, they rely on them, they count on them. You don't need the supplemental screening. And in fact, there's been peer-reviewed articles, right, that have been done surveying why is it that women in North Carolina for years, right after we had the dense breast density notification law passed, and that was passed in 2013, why wasn't supplemental screening uptake increased in the state? And they compared us to New Jersey, who had the notification law go into effect around the same time. And in New Jersey, the number of supplemental screening procedures went up substantially. In North Carolina, they did not. And the authors concluded it was because in New Jersey, insurance covered supplemental screening, and in North Carolina, insurance did not. So insurance really dictates, not only the financial burden that a woman's going to suffer if she asks for the supplemental screening, but also whether she's going to be offered it or not, or even, push back away from it when she asks for it. So insurance is unfortunately the key.
So I shared with you a little story about a friend of mine who she heard my live, I think it was the live that she heard that I did with Leslie with My Density Matters, or the podcast episode that I just did with her. And she reached out to me and said, I have a question. I don't know if you can answer it or not, but I've got dense breast tissue. I went in to get my mammogram and I had an ultrasound, that extra screening. And then I got a $2,500 bill. And she said that she did try to push back and said, hey, insurance, because she's the one that asked me if I knew about Gale's law. And she said that here in Nevada that they're supposed to pay for the supplemental screening. And I asked her what insurance she had and where she went. She said that the insurance company and the hospital, the breast center, none of them helped her at all. They were no help at all.
Yeah. Yeah. And we hear this a lot. Insurance companies like to play games to deny coverage. And, there are several states who have passed laws to expand insurance coverage for supplemental screening to include things like ultrasound and breast MRI for women who have dense tissue. In fact, there's now, I understand, based on Joanne Pushkin, she puts together a website showing, how many states have passed laws and who they are. There's now 38 that have done that. 12 have not, including my state of North Carolina. Nevada is one of those states that has passed the law, but yet we hear over and over again how insurance companies change the coding. They say it's not screening, it's diagnostic, and therefore you have to pay. That's why fundamentally we need the Find It Early Act at the national level, or we need laws at the state level that really make sure there's none of these loopholes, none of these abilities for the insurance companies to avoid paying for the additional screening. And in fact, I have to say, it's such an absurdity. In my state, Medicaid did a study, and they determined that it was much more affordable for them to cover the cost of the supplemental screening because Medicaid here determined that the cost differential between a stage 2 versus a stage 3 diagnosis is so significant, it's like $30,000, that it made sense to pay, a few $100s, even $1,000 for that extra screening to avoid that later stage diagnosis and the associated treatment costs. For the same reason in my state, the state employees health care plan also covers the supplemental screening. So in my state, the only women who don't get it are two. One, people on private insurance, which seems totally upside down, right? Because we're paying for our insurance. And then the second thing is Medicare still doesn't cover, which is, unfortunately something that has to be addressed at the federal level. People on private insurance do better than Medicaid recipients, but not in this case.
So I know that insurance companies are relying on people giving up.
Yes, they are. Yes, they are.
And I heard that from a couple of different people who work in the medical field, talking about how insurance companies, when they're working there, are sort of trained to figure out a way to deny.
Yes, they are. And AI is trained. Now they use computers, right? It's not even a human element anymore.
Right. So and this may have been the case when I was going through my active treatment. I developed this really rare anemia. It was pure red blood cell aplasia anemia.
Oh,
I didn't even know
so
there were
sorry.
any other kinds of anemia other than iron. I didn't know.
Yeah, I didn't either.
But I had to get a lot of transfusions,
Oh,
and
I'm so sorry.
hemoglobin was dangerously low quite a few times. Had to be hospitalized a few times.
Oh.
Well, one time my insurance denied a hospital stay and a transfusion because it said not life-threatening, when it really was.
It really was.
And so I gave it to my oncologist, and so she appealed it, and then they went ahead and approved it. But my question is that who is reading that, whether it be AI or a person who has no idea that when you hear the word anemia, you think iron, right? And
Right,
iron,
sure, right.
right? So I learned quite a bit when it came to that. And if I had to appeal it, to take the letter and use the verbiage that they use to appeal it. And I've kind of been learning from a few different people who are really well versed in the insurance field. So, but What
But
is
is
it?
that really necessary? You think about
Oh,
you're going through treatment. Treatment
yes,
is so hard.
yes.
It's just with chemotherapy, with radiation, surgery, you're exhausted. And shouldn't you be focused on taking care of yourself so that you can recover and get back on your feet? Instead, you're wasting all your energy fighting with insurance companies. And
Right.
what about women who have children at home who are still trying to keep a family intact while they're going through treatment? It's unbearable. I mean, insurance companies are unconscionable.
Yes.
And you think about it, they do all these antics. Their CEOs make tens of millions of dollars. And all we're trying to do is just get treated, right? We're trying to get treated and we're trying to get our cancer found when it's early, when it's when it can be treated with the least devastating effects on us and when we have the best chance of survival.
Right.
It's ridiculous.
It is.
It's ridiculous.
Yeah, and the people who haven't had breast cancer yet, and they're just trying to follow the advice of making sure that early detection saves
Yeah.
lives,
Yeah.
knowing their breast density, and they go in, they get this mammogram and the ultrasound, they get this bill for $2,500. What
Crazy.
do we tell people? Like, how do they advocate for themselves? Do you have any advice for them? Because you said that the insurance companies are relying on that. Number one, why is the breast center not helping this particular
Because they're
person?
overwhelmed. They're
Okay.
overwhelmed. They're just overwhelmed. They're seeing patients in 15-minute increments, and then they get all this paperwork, right, on top of it. They're just overwhelmed. And insurance companies, I had to go through an appeal with an insurance company. I also have lupus, and for 20 years, I've been stable on, a drug that costs less than 10 cents, right? A pill that costs less than 10 cents. And the insurance company out of the blue, I think, because I'm fighting them right now in North Carolina, I think it was retaliation. Blue Cross Blue Shield just canceled and said, one day used to pay $10 a month for my pills. I went to the pharmacy, and the pharmacist says that will be $3,300. I'm like, what are you talking about? $3,300? Blue Cross Blue Shield refuses to cover this anymore. And so I actually had to go through appeals for 6 months. I had the Lupus Foundation of America, right, help me. I had my doctor repeatedly say, this patient is stable on this. They came back and they said, well, we want her to try all these other drugs. And unless she dies on these other drugs, we want her to, try these other things. And I don't know how they could have been more affordable because my drug, like I said, was 10 cents per, pill. It was the craziest thing. And we appealed and we appealed and finally got to the point after 6 months that an independent board, two doctors, independent from Blue Cross Blue Shield, came in to review everything. I had to present like a lawyer. I had to present, why I should, all the scientific evidence, why I should stay on this drug. And I had tried the other drug they wanted me to go on previously, and it didn't work for me. My lupus flared. But it's a matter of just being tenacious about it and not giving up. But the problem is, again, when you're going through breast cancer treatment or when you're trying just to get yourself the additional screening to make sure you don't have breast cancer, you've got other things in your life. Like a lot of us just give this up. I think fundamentally, you have to fight on an individual basis. You just have to stick with it. But fundamentally, insurance has to be reformed. It really does. It's not appropriate that, when doctors say you need this, when scientific evidence say you need this, that should be it.
Yes.
And I think right now the biggest problem is the U.S. Preventive Services Task Force is giving the insurance companies the ammunition
Yes.
to deny it, because the U.S. Preventive Services Task Force, which does not include any oncologist or any specialist in breast physiology, basically said there wasn't enough evidence to that having supplemental screening and finding the breast cancer earlier saves lives. Which is ridiculous because there was a huge study called the BRAID study, BRAID, that was recently completed with, thousands of women, which basically demonstrated that a breast MRI found 17 tumors that were missed by mammograms, right? And so it's so clear that if early detection is the key, then you want to have a breast MRI or even an ultrasound, although an ultrasound is not really that great. To find your breast cancer early. Otherwise, are they basically saying that early detection doesn't mean anything? I don't get it. It's illogical. And the other,
It's upside down world.
yeah. And the other thing is, breast cancer, people are still dying every day. There's 115 or so women who die of breast cancer. That's equivalent to a mid-sized jet crashing each and every day. That's a lot of women. But,
Yeah.
Separate from the whole, are they going to live or not? What about morbidity? What about the quality of our lives? If you find breast cancer early, you just take it out. You might have a few radiation treatments, maybe you have chemo, but the later they find it, the more likelihood you need a double mastectomy, multiple rounds of chemotherapy, multiple rounds of radiation. It goes from a relatively easy procedure to recover from something that's going to take you 9 to 12 months to get back on your feet.
So you had mentioned earlier about insurance. It would cost them less to have the supplemental. So what is their motivation? I know that money's always the motivation, but
Hoping you age out, that you go on Medicare and you're no longer their problem, or you go to another insurance company. But the issue with this whole idea of aging out is women are getting breast cancer earlier and earlier. So we're not going to age out. We're going to die before we age out.
so you would think that they would know this and and cover those because in the long run it will be less expensive for them.
It's all about short-term profits.
Okay. Interesting. Okay. So you've been deeply involved in advocacy efforts like the Find It Early Act. What changes would you most like to see happen in the next few years?
That every woman across the United States, regardless of what state she lives in, gets access to supplemental screening, and insurance has to cover it. And all the loopholes where insurance can reclassify something so it's not covered, like reclassify it from screening to a diagnostic. I mean, they have lots of tricks that they do. Would basically, all those loopholes would be taken away. And there would be some kind of punishment, some kind of penalty, right, for insurance companies putting these barriers in front of women, reclassifying or overriding, right, a doctor's specific orders. I think without some kind of penalty for insurance companies, it doesn't cost them anything, right? To sort of blatantly violate the laws and just put obstacles in front of women where they cannot get access to the supplemental screening. I also think that doctors, there has to be some kind of allocation, federal allocation, state allocations, of resources where doctors are educated on the need for supplemental screening, because I still believe that that a lot of doctors don't know. When I went back to my GYN, who was on faculty at Duke, very well respected, and said, "Hey, why didn't you recommend supplemental screening for me when we talked about it?" Right? I raised this question with you, and he honestly said he didn't know about dense tissue. And that's a problem, right? That's a real issue. And so I think, there has to be some kind of mechanism where doctors through CLE, I don't know, somehow this is a significant issue because 1 out of 8 women get breast cancer. Doctors need to be educated.
And it's so weird that he didn't know about it.
Well, I don't know. It was shocking to me, but it was more aggravating and it made me quite angry because I trusted him, right? It was a betrayal in trust. I have to do my job. I used to practice law and I had to keep up to date on all of the new laws that came out. You would think that doctors have to keep up to date on all of the new, scientific findings or whatever. But he said, I really didn't know about dense breasts. I didn't know this was an issue.
It seems that women have had so many barriers, so many obstacles throughout history. And what why is this happening? It's just astounding to me that women's health is not taken more seriously, I guess.
Yeah, well, I could comment on that so many ways. I can't tell you because, I've been advocating in my state with Susan Cohen and with the American Cancer Society. We've introduced several bills in our state legislature to make it supplemental screening more accessible for women, including expanded insurance coverage. The bills have passed our House unanimously or almost unanimously. They get in the Senate, and the Senate GOP, this character named Senator Phil Berger won't even let them out of committee for a vote. Blue Cross Blue Shield backs him. It's about money in our state. And, I'm basically, because I've been standing up to him and I've been very public about it. And I'm basically told, be a good little girl and, don't be so outspoken on this. That's not how you make change. And I'm like, really? I mean, my life was almost in jeopardy. I could have ended up with the stage 4 breast cancer diagnosis very easily if I hadn't demanded the supplemental screening, if I hadn't been so bold and stood up for myself. I'm now advocating for other women because I wish somebody would have done that for me. And, if I don't have the platform to be able to do it, I've created a lot of jobs in the state, paid a lot in income taxes, have a high profile. If I can't do it, then nobody can. They just can't. But it's almost to the point where it's so ridiculous when I've been advised when I go to the state legislature, don't use the word breasts because it makes the men feel uncomfortable. Well, how do I talk about breast cancer when I can't use the word breasts? It's like there's nothing that I should be ashamed of. It's part of my physiology. It's absolutely ridiculous. And I've also been told, and in the early days I did this, to advocate through men. So I have to use men in order to talk about and advocate on a woman's health issue. I mean, until women, I guess, are perceived as equals, we can't advocate for anything, I think, that's going to help us. I mean, it's really absolutely absurd. I have felt embarrassed about talking about these issues. I have been ridiculed, right? Even Blue Cross Blue Shield, when I criticized them for basically, because I've met with them, right? And they basically said until the U.S. Preventive Services Task Force changes their stance, they don't see there's any justification for changing theirs. And I've been very open about that, criticizing them. And they had this alter ego called Coalition for Affordable Healthcare North Carolina, where they beat up on me and call me a liar and say, because I'm advocating for the supplemental screening, that I make women feel uncomfortable about breast cancer and whether or not they can trust their doctors. I'm like, what? We're not supposed to be educated. It's the most absurd thing.
It's such an enormous systematic problem that how do you get through it? So it makes me think about, so I'm a former social studies teacher. So I taught a lot about movements and like the women's rights to vote and how much effort it took from generation to generation to get to the point where women finally got the right to vote. And I think about what those women were thinking in the moment of trying to, with their efforts. It's like, is this ever going to happen? Like we have to go through this, and this just to be ridiculed in these misogynistic circles. And here we are in 2026 fighting for women's health and having to still go through men that ridicule and make you feel like you did something wrong.
Yeah, I did something right. Yeah. I'm victimizing them while I was the victim.
Oh my gosh. Well, all I can say is I really want you and all of us to continue causing a ruckus, because what that person said is, being outspoken like that is not the way to go about it. Oh, well, I have something to say that, yes, it is. Yeah, if that's what we have to do, then that's what we have to do. And I still don't understand, the whole thing about not being able to use the word breast. I mean, come on. If we're fighting for men's, health, and can we say testicular cancer? It's all such an upside down world. I'm really sorry that you've been going through that. On the other hand, you are a new survivor, really working your ass off in all of this. And I am so grateful. And so I want to know what gives you hope right now when you look at the work that's being done across the country to improve breast screening access.
Things like Gale's Law. It's unfortunate that Gale passed, and this is the law in Wisconsin that is expanding insurance coverage for supplemental screening. She worked very hard. She was like many of us. She did what she was supposed to do. She showed up for her mammograms every year. But yet, she didn't get diagnosed until she had stage 4 breast cancer because mammograms missed her cancer. It's so sad. And I really am grateful to people like her who came before us, Leslie Ferris-Yeager, My Density Matters, Joanne Pushkin, right? so many voices who have been beating the drum for so long. But fundamentally, unless we all unite, and I think we are now doing that across the country, we all unite and we all collaborate and we all raise our voices saying, we're not going to allow this to happen to our daughters. We're
Well,
not going to allow this to happen to our daughters.
yeah.
We need supplemental screening. We need it to be accessible and we need it to be affordable.
Well,
You know, European women get this. This is the
yes,
amazing thing.
they
It's
do.
just, why is it that in America we have to fight for this fundamental right?
Mhm. Yeah, that's a very good question. And I'm really grateful to be in the circle, in the huge circle that's being formed across the country. And that is one of the things that Leslie and I talked about again is that how collaborating with other patient advocates is so powerful. And if we can get this huge coalition just to keep growing and keep working at it, keep fighting, I think hopefully we'll see some change. So I'm glad that that gives you at least some hope there. It gives me hope as well. So for someone who's listening who has never been diagnosed, and I ask this because a huge part of my audience are people who've never been diagnosed. My whole goal our mission is to educate those people so that they have a lot more awareness on their risk factors, what kind of screening they need, what dense breast tissue is, what kind, how to deal with insurance. So for someone who's never been diagnosed, what's the one thing you want them to understand about breast screening and knowing their breast density?
So you can find your breast density based on your mammogram. And you also should be getting a letter because the FDA issued a proclamation back in September saying that all women should be notified if they have dense breast tissue. So if you have dense breasts, you should get supplemental screening. Do not. I mean, I feel like I was tricked in believing this nonsense. We hear a lot about, well, they can prioritize women and based on different risk factors, figure out who has the most, who has the most risk of getting breast cancer and who has less risk. I was told I had less risk. I don't think the analysis is really fine tuned at this point in time. I don't think we're there yet. I think fundamentally, if you have dense tissue, you go to get a mammogram to basically see whether or not you have breast cancer and to find it early. If you have dense tissue, they can't tell, right? They can't tell. They're missing 50% of tumors in dense tissue. So you need the second step. You need to have either an ultrasound or even better, a breast MRI. You don't need a breast MRI every year because most of our cancers are slow growing. European women get it every third year. But you need the second step. Otherwise, it's a crapshoot. They may have caught your cancer, they may not have. You get the clean mammogram report, it doesn't really mean you don't have breast cancer. So
So if they are dealing with insurance, so it's before they go in, they know that they need to get this extra screening. What do they do before they go in to get that extra screening? Should they get a pre-authorization so that they are aware of whether it's going to be paid for or not? Because this woman just thought that it was going to be
big
paid
bill.
for. Yeah.
So honestly, I mean, I don't know. It's very unfortunate, but if I had to do it over again, once cancer starts growing, it's sort of like the genie's out of the bottle. You have one chance to find it early. And I would say insurance and payment should be a secondary consideration. I would go get the screening and then fight with the insurance company at the back end. And usually you win, especially now with there were changes to the Affordable Care Act with Obamacare. Technically, there's now a federal law protection, but the problem is without a state law sort of reinforcing it or codifying it, how do you enforce it? But under Obamacare, we're all, if you're in private insurance, for screening purposes, we're all supposed to be getting access to the supplemental screening if you have the dense tissue. Problem is the insurance company played games and they recoded as diagnostic as a way to avoid the payment. You fight with them. You fight with them. You fight with them. That's just it. You don't give up. But I would not delay getting the screening.
Would you recommend that the friend who's already gone through this has fought the or appealed and all of that. Would you recommend that she continues to appeal?
Well, that new amendment came into effect January 1, 2026. So it depends on when she did the screening. If it was after January 1, 2026, I would continue to fight. Eventually, they're going to fold.
It was.
Yeah,
I think
eventually they're going to fold because they're in the wrong. But again,
is there any information that I can send to her that might be helpful for her to curate what she'll send back to them that I might be able to give you?
All she has to do is just go on the web or just use AI and talk and ask, underneath the Affordable Care Amendments, is supplemental screening now covered under federal law? And that should bring it up.
It'll give you the evidence and everything. Yeah.
Yeah. Huh. But again, insurance companies are bad actors. They will do all the bad things, until there are, I believe, penalties, enforcement mechanisms. And that really requires a state law, supporting and codifying the federal law, and then putting some kind of enforcement mechanisms, some kind of penalties and some kinds of mechanisms where women can easily resolve these disputes. Otherwise, without that, why wouldn't they be badly behaved? It doesn't cost them anything.
Right. They sleep well at night in their piles of money. Oh, yes.
It's not good. It's not good.
Yeah, I hate that. And it's just crazy. Well, let's keep on pushing. And
it's just fundamentally, they have a different objective. They're there to make money, and we're trying to keep healthy.
Hey, I like making money, but I like making it not at the expense of others. So,
yeah.
Expense is fun. Yes, the expense, but not in a morally expense.
Yeah, I agree. I understand.
Bad actor way. Yeah. Well, Sheila from BC Ruckus, please keep causing a ruckus. I'll cause a ruckus too. And I'm just thrilled that you are on the show today. This has been so educational for me and hopefully for our audience, and we'll just keep on pushing. Is there anything you'd like to say before we disconnect today?
No, Jamie, I just really want to thank you and show my appreciation for everything you're doing, right? I wish I had listened to some of your podcasts before I was diagnosed. I would have been better equipped to protect myself. And I'm just so happy, right, that people like you are spreading the word so other women have a better chance to find their breast cancer early. Yeah, we deserve better. We really do.
Well, that is why I started the podcast, because there was so much I didn't know, and I don't want other people to go through that. So thank you for recognizing that. And I appreciate, again, you being on the show. And we will have all of your contact information, any kind of resources in the show notes. And to my audience, thank you again for joining us on this episode. And we will see you on the next episode of Test Those Breasts. Bye for now.
Bye-bye. Thank you.
Friends, thank you so much for listening to this episode of Test Those Breasts. I hope you got some great, much needed information that will help you with your journey. As always, I am open to guests to add value to my show, and I'm also open to being a guest on other podcasts where I can add value. So please reach out if you'd like to collaborate. My contact information is in the show notes. And as a reminder, rating, reviewing, and sharing this podcast will truly help build a bigger audience all over the world. I thank you for your efforts. I look forward to sharing my next episode of Test Those Breasts.